Hello and welcome to my training PowerPoint on treatment plan for anxiety disorders and obsessive compulsive disorders. Today we are going to focus specifically on a treatment plan for social anxiety disorders. I am your host Cecilia Dunn, so let's get started. This training video, these are the topics which will be discussed. We will go over the introduction, what social anxiety disorder is according to the DSM-5, how does social anxiety affect teens, evidence-based therapeutic interventions, family therapy interventions based on current evidence, and the best current medications used for social anxiety in teens. We'll go over the best apps used, informational websites, and educational resources that can help teens with symptoms of social anxiety. We'll go over cultural and diversity issues, and then there'll be a summary and followed by references. Social anxiety. Social anxiety disorder is an anxiety disorder that causes a person to have a persistent fear of others. Maybe they're watching, judging, and they feel that they're scrutinizing the person's actions, such as when a person has to speak up for themselves and assert themselves, or in trying to meet new people. This fear of being judged can be so intense that it can affect the individual mentally as well as physically, causing them to feel fear and an anxiousness about the possibility of being humiliated and rejected. Why is it important to know about social anxiety disorder? Well, data shows that 10% of adults experience social anxiety disorder. Studies show that 90% of these cases occur between the ages of 13 and 18. Therefore, it is imperative that teachers, counselors, and other school personnel are educated in recognizing how social anxiety hinders students and finding ways to help students receive the proper care that they need. Teens who do not treat their anxiety are at risk of developing depression, anxiety, and falling into substance abuse. Social anxiety disorder according to the DSM-5. According to the DSM-5, the individual must have feelings of anxiety and or fear in more than one social setting, where the individual is going to be seen by others and possibly examined for what they say or do. Examples of this could be a new student having to introduce themselves to people that they are not familiar with, or when an individual has to give a speech in front of their class. B. The individual will feel as if they are going to say or behave in a way that is going to be looked down upon, or they might be completely humiliated, such as saying something and having others laugh at them. The onset for social anxiety disorder is highest amongst adolescents age youth, because 10% of adolescents by the age of 13 develop symptoms of social anxiety disorder. Adolescence is a developmentally sensitive time with significant changes occurring within one's physical development, as well as changes occurring within the brain. Adolescence is a time of vulnerability where teens are at risk of developing mental health disorders. C. Almost all situations cause the individual to feel a sense of fear and anxiety. For individuals, it can be talking on the phone, having to conversate with other coworkers, and for teens, it can be just interacting with their peers or authoritative figures. The individual will avoid social situations at all costs by isolating themselves from others. If the individual must endure social situations, they are going to feel distressed and worrisome. In teens, you may see them freeze up and fail to speak out. D. The fear that is felt is not justifiable to what is actually taking place in their social situation or within the individual's belief, gender, status, values, socioeconomic status, and aspects that encompass one's cultural environment. E. The individual's symptoms are not new symptoms. They have likely endured these feelings for more than 6 months. Okay, going on to G. The anxiety and fear must cause a great amount of hardship in one's life. It isn't just that the individual is nervous about that they have to give a speech in front of the class. These individuals dread every social situation they have to be in. This can affect how well they interact with people they are close to in work and in school-related settings. H. The symptoms present are not attributed to effects from medications that they have been prescribed, such as stimulants that treat ADHD, asthma medications, or medications for migraines that might contain caffeine. The anxiety and fear are not attributed also to the use of drugs and alcohol use or other medical conditions such as diabetes, or like when someone life depends on taking insulin, thyroid conditions, or nutritionally poor diets that can cause feelings of nervousness and anxiety within the body. In addition, symptoms are also not a result of other mental disorders such as body dysmorphic disorder, obsessive compulsive disorder, or a neurological disorder such as autism spectrum disorder. I. Assessing further, it is possible that these individuals have other disorders present. However, their symptoms must be unrelated to their condition. And then we look at the specifier. The only specifier listed in the DSM-5 is performance. What this means is that the individual becomes very fearful and anxious when they have to publicly speak in front of others, but this can also manifest for those who are athletes or musicians, where all eyes are on them. People who have a specifier or performance are not likely to be afraid of encountering people in smaller, more intimate groups. How does social anxiety affect adolescent-aged youth? Well, we know adolescent teen years are a very stressful time for all teens. There are physical, biological, and developmental changes taking place, as well as changes occurring in the brain in areas responsible for learning and plasticity. Teens are at an age where they're experiencing an increase in their emotional responses, and there is more understanding of the social world that is around them. It is thought that the public aspect of self-consciousness, or the ability to see oneself as a social being that affects others, is thought to peak during this time. This period of self-consciousness is developmentally essential and helps teens to build stronger socialization skills needed in relationships with peers. They become aware of the fact that their level of anxiety is more than it should be, which can further exacerbate their level of physiological arousal. Teens with social anxiety report having fewer friends. As a student with social anxiety, they may begin to have an inability to concentrate due to worrying about being judged negatively and feeling that this impending doom in having to interact with peers and adults alike. Students may complain of physical symptoms such as stomach aches, headaches, trembling, or having sweaty palms. It will likely be difficult for them to participate, to ask questions, or to ask for help. Attempting to make small talk with other peers is dreadful. Adolescents with social anxiety are likely to not achieve their greatest potential in school because they are likely to be the victims of bullying. It is also common to see individuals a little nervous within their new professional notices that these students are having difficulties after approximately 6 months or so, that is when professionals would speculate that students have anxiety disorder. So how does social anxiety affect adolescent age youth? This is part 2. In many cases, social anxiety is not caused by a traumatic event. In a majority of cases, there's a genetic predisposition. It is also possible that the individual has a social avoidant behaviors that have been modeled in one's home. Research shows that most teenagers who have social anxiety disorder do not receive the help that they need. There's a misconception that teens who have social anxiety just have an introverted personality type, or that they're just shy, or that this is a part of the normative teenager experience. And lastly, there's this misconception that teens will eventually grow out of it. If social anxiety is left untreated, it can become a chronic condition that is carried into adulthood and can increase the risk that these individuals struggle with depression, suicidal ideation, and suicide attempts. They are at risk of becoming isolated because of their social constraints. And lastly, they are at risk of using alcohol and substance abuse. Findings show that social anxiety is higher for girls at 11.2% than it is for males at 7%. Let's take a look at some evidence-based therapeutic interventions. We know that CBT is an evidence-based intervention that is used commonly in psychotherapy to treat adolescents with social anxiety disorders. CBT, or cognitive behavioral therapy, teaches teens that they can learn to identify their problematic thinking patterns and learn to change their existing thinking patterns. Changing one's understanding of how they perceive the world around them can and will change how the individual exhibits behaviors and reacts. Cognitive behavioral therapy teaches individuals with an array of anxiety disorders to learn skills that are imperative to socializing. Group therapy using CBT in a group setting, an individual can be a part of a group of peers that also struggle with social anxiety disorder or social phobia. Group therapy is essential as it can offer support to those struggling with social anxiety by helping them to know that they are not alone. Group therapy can also incorporate teaching teenagers about anxiety and how some level of anxiety is normal, and what a teenager can do when they feel as if their level of anxiety is becoming more, as well as discussing coping strategies. Younger teens may not be able to identify their anxiety symptoms and may describe it in physical symptoms or acting out. It's important that parents and teens are educated about the causes of social anxiety and how family members can help. Family therapeutic interventions have shown to be better treatment outcomes when families can work together. One family intervention is to help teach parents or caregivers through parent training. An example is teaching parents exposure therapy and how to effectively learn to help their teens with social anxiety. Family members can do this by learning behavioral managing techniques to manage the behaviors that are associated with anxiety. Lastly, in family therapy interventions, families can learn to manage their difficult situations by noticing their own behaviors and body language, how they parent their child with social anxiety, such as being aware of their tone of their voice and becoming less demanding and more empathetic. Lastly, learning to validate their teens by actively listening to them and not simply accommodating them or reassuring them every time they are afraid. So what are the most effective medications used to treat social anxiety disorder? When psychological interventions are not enough, the first-line medication used to treat social anxiety disorder are selective serotonin reuptake inhibitors, or SSRIs, which work at increasing levels of serotonin, a neurotransmitter in the brain responsible for giving us feelings of happiness and contentment. With adolescent-age teens, it's up to the general practitioner to weigh the benefits and risks because medication is not usually prescribed for social anxiety at this age, and there may be risks of for the developing brain. The SSRIs are most prescribed for children and teens under 18 would be the fluvoxamine, which is used to treat obsessive-compulsive disorders, depression, as well as some anxiety disorders. They work at decreasing levels of worry and obsession. Beta adrenoceptors are used occasionally to treat social anxiety disorders, but may only eliminate like a fraction of the symptoms. What are the best resources for teens, including apps, informational websites, client educational resources? I listed Super Better, which is an app that was created by a game designer named Jane McGonigal. It allows teens and adults to engage in gaming while building psychological strengths, reducing depression and anxiety, while supporting recovery. Number 2, I listed Headspace. It's an app that was created to help its users to find ways to reduce stress and anxiety through evidence-based meditations and mindfulness techniques. It helps support one's mental health and create life-changing habits. 3 informational websites I included was the Anxiety and Depression Association of America, or ADAA, which is a website designed to offer information about various anxiety disorders such as well as clinical trials, facts, and statistics. ADAA offers resources for professionals as well, such as conferences and ways professionals can earn CEs. It is also a place where individuals may be able to find a therapist based on their location. Number 4 was Child Mind Institute, which offers families and educators information about therapeutic groups on how to help families with an array of conditions such as ADHD, anxiety disorders, and behavioral issues. The website is backed by science and talks about their science programs, up-to-date news on youth and mental health issues. 5 is the National Alliance of Mental Health, or NAMI, is a website which supports those with mental health conditions and education and advocacy for those who have mental health conditions or want to know more about mental health conditions. NAMI also has several helplines that are offered to help those who are needing some support or just having a hard time coping in their situations. Other phone lines included is the Crisis Line, the National Sexual Assault Hotline, the National Domestic Violence Hotline. Lastly, I want to include the anxietyinteens.org website because it is a website specifically for teens, written by teens who have struggled with anxiety disorders. It also offers groups for parents, teens, who are facing mental health issues, and that's at anxietyinteens.org. Research has shown that ethnic and minorities are not represented fairly regarding mental health. As an example, those who are part of minority groups are more likely to not receive the mental health treatment they need because they may not believe in seeking treatment. They may not have the means to see a therapist, and in some cases, adults and teens are misdiagnosed because of how they describe their symptoms. Some cultures may describe their experience with social anxiety as feeling physically ill, fatigued, or feeling like the wind is in them. Therefore, it is imperative to know some culturally specific terms used to describe social anxiety or social phobia. What individuals perceive to be norms, including gender roles, beliefs, sociocultural behaviors, and how close they are with their families, such as seeing themselves as part of the family unit or as an individual within a family. So it's important to know about mental illnesses and how they can affect adolescents, teens, especially anxiety disorders such as social anxiety disorder. Social anxiety disorder can be debilitating for teens, and it is not part of the normal teen experience. If teens who are struggling with social anxiety disorder do not receive help, they are at risk of learning to cope with their fears and anxiety in unhealthy ways, such as becoming avoidant of places where people will be and feeling left out of activities, such as being involved in sports and clubs and other gatherings. Teens with social anxiety are at risk of falling behind in school, being self-critical, and at risk of alcohol and substance abuse. By understanding what is the most effective interventions and family interventions, school staff and mental health professionals can offer students the most appropriate support. They can advocate for their teens and show them empathy. I leave with you this quote to share with the students you work with. In case no one told you today, you are beautiful, you are loved, you are needed, you are stronger than you think. You are going to get through this. I am glad you are alive. Don't give up. Here are some of my references that were used. Lastly, here's additional references that were used. I want to thank you for attending this training conference on creating a treatment plan for social anxiety disorder.